In this session today, it is one of my favorite sessions because the very fact that we've got to this point means that we've covered some important things in your rehabilitation program. We will have covered that you've had a physical examination by a healthcare professional that you're currently working with, or by your doctor to ensure that you've got nothing serious as a cause of your aches and pains. And we have been working through a series of concepts coupled with exercises in building your program. And we have introduced the idea that pain acts as an alarm system, not set off just by tissue damage, but lots of different things can set off our alarm system, tissue damage being one of them, but it's this multi-dimensional system that's protecting us, and it is going to be individual, and you will have had a chance to identify some things that could be keeping your nervous system sensitized. We will have looked at and discussed some things around tissue damage and pain not being one and the same, and coming up with some metaphors and some examples where that's true and makes sense to us. For example, we could sprain our ankle crossing the road, tissue damage, and if there's a car coming towards us or a bus that's about to run us over, we probably wouldn't feel the pain until we got out of the way of the bus. Tissue damage is going on, but we're able to produce or kick in our internal drug habit in the brain to be able to get out of the way of the bus. Tissue damage, but no pain. Once we get out of the way of the bus, the bigger threat's not there, it's appropriate for us to be able to feel pain. We will have talked potentially about some other ways that some of the maybe structural explanations for your pain, like your posture, like disc bulges, like your rotator cuff, like the age of your knee, or any of these structural explanations for your aches and pains as to how they potentially are not a one-stop fix or explanation for the pain that you may be been experiencing, and that the nervous system can have different places that it can dial up its protection, right the way from the nerves, where we have different sensors that can be that are being relayed all the time. They can be set off by blood flow, by our immune system, by movement, by injury. They can be set off by temperature. These are things that can happen in our nerves. We can have changes in our spine, and we can have changes in our brain where we can get blurry pain, blurry body maps. And it's possible that if you've had aches and pains for a period of time, that your brain has become metaphorically dry, less efficient at producing the internal drug habit in the brain that we would hope to get from exercise. Okay, so at this point, and why I like this point is because hopefully I've done a job in getting across what pain isn't. And that's probably a fair reflection and giving you a definitive answer for what is causing your pain. And that's hopefully also makes sense that nobody can give you that explanation because pain is an individual experience to you. Okay, and through this process, we have been hopefully starting to engage in certain types of physical activity, relieving movements and gentle things that could be helpful. If you've done the stress physiology session, then maybe you've started doing some things that are meaningful to you, things that are relaxing, things that give you flow, and they could be very, very traditional things like yoga or stretching or breathing, or they could be equally things more personal to you, like getting out into nature, like playing a musical instrument, like meeting up with your friends for a coffee. And that's something that's hopefully you've been doing. Hopefully you've got a series of relieving movements and exercises that you can do when your aches and pains are sore. And in this session, we're going to be going through just connecting some dots around some of the ideas around how our nervous system can work, to give us another type of exercise that most people are probably most familiar with how we work, particularly back to roots, in terms of bringing play and making movement and exercise fun. And this is an important session to connect that. And I'm going to start off this session by sharing a short video where I went down to stay with my sister who has a new puppy. And there's a book that I read many years ago called Don't Shoot the Dog, and I have a special interest in training animals because I think it's very similar to how I would be trained as a human, and the mechanisms are quite similar. And I want you to have a look at what we did in a very short time. Barley, apart from a super cute little dog, what you will have noticed there was we were doing, sorry, just stop that, move it in there. What you will have seen there was associative learning in action. And if you've ever trained a dog or trained animals, then you will be familiar with this as a concept that was first developed back in the 30s, and it's known as Pavlov's dog, where you can take something that is an automatic response. So when Barley would see food, he would have a vision, he would have a smell, and he would have an automatic output, and as a response would be salivation in preparation for food. And if you can get a clicker, which is what I got Holly to do, my sister, with Barley, every time she gave him the food, click, every time she gave him the food, click, then those two things, see the food, hear the food, see the food, smell the food, and salivate, but also hear the click. Over time, those things become associated so that we can take the food away, and just the clicker will mean that Barley is looking for the food and will produce salivation. So that's associative learning in action. And the fancy way that we describe that and understand that is that neurons, which is the cells that we've been talking about in our nervous system, that fire together at the same time they associate, or they wire together. And it again leads us to this idea of neuroplasticity and the fact that our nervous system is changing all the time. You are learning. If you've got kids, you'll see that this learning process is going on the entire time. And when you can get a clicker to associate with the reward, then you can see for those behaviors, and you can click it when they do something else. And you can see there that I was trying to get him to lift his foot and click, reward, lift his foot, click, until I could get the point where click it, and he twitches to lift his foot, and he click it, and he eventually figures out, well, that seems to be a good idea. When I do that, I get food. Paw. This one seems to be the same. Paw and put in hand out, and they click it, and I get the reward. And after about 10 minutes there, he's very easy to reward. You saw my sister being able to get him paw on this hand, down, paw on this hand, down. And from behavioral studies, we know that if, and you can see that there, if the outcome of a behavior is a positive one, we are more likely to do it. And that then has a counter to that, which is going to be brought into the relevance of where this is in our rehabilitation program. Because if every time Barley brings his hand up to the command of paw, and this time I don't click the clicker that he's associated with food, I click another one that puts an electric zap around his neck, boom, electric shock, boom, electric shock. It wouldn't take long before he would learn that paw leads to a bad outcome. And we are far less likely to do an activity again when it has a bad outcome. And that has implications for this session that we're going to go through. So, and the first thing that the next thing that I want us to do is a short thought experiment. I want you to close your eyes, and I want you to picture somebody important to you. I want you to picture perhaps a grandmother, and that may elicit a positive or a negative experience based on your relationship with your grandmother. But I want you to try and see if you can remember something that you did with your grandmother. Maybe it was, something I used to do was go and feed the ducks around a lake, and I've got a very strong, clear memory of that. So see if you can come up with something yourself. I want to see if you can imagine her face. I want you to see if you can imagine a smell. Can you remember something that she used to cook in her kitchen, or food that she used to make you? Can you imagine her doing the action of cooking? So can you see her moving? And I want you to open your eyes. And if you were able to do that, how we used to understand how the brain would work, that all that information that you just did about your grandmother would pop up with the grandma part of your name. And the research was actually done using something called, and this was called grandma neurons, because it's the same thing they did. But how we understand the brain and our nervous system now is that as you were thinking about, well, could you see her face? Then the part of your brain at the back that would have been, that processes vision, would have increased its activity. As you were trying to remember something that you did, an emotional experience, that emotional part of your brain would have lit up. If you could see her moving while she was in the kitchen, the movement part of your brain would have lit up. And to be able to remember that thing that she used to cook, the olfactory or the smelling part of the brain would have lit up, and we'd have developed this signature of electrical activity in your brain that would be connecting all of those memories that you were able to just connect to your grandmother. And if we were to see that on an MRI scanner, you don't need to understand MRI scans, but this would be like a cross-section of your head by here. And this scan, what I want you to notice is that it's nice and quiet as you're sat there with no particular task at hand. Ask you about your grandmother, and we would have then seen all of these red blobs lighten up with activity all around your brain, which is how we know that that is the nature of your grandma signature or grandma neurotag, visual part, olfactory, smell part, movement part, and all connected together for you to be able to have the memory that you just had in eliciting that experience. And the reason this is relevant, because all of these parts of the brain that are connected up into this individual signature that makes your memory personal to you, and only you can have all of this specific memory pathway for your grandmother, is that this is exactly how we understand pain to work as well. It is an individual experience that will be based upon movement, based upon your senses, so what you can see, what you can smell, what you can feel, what's coming in from your body, how your movement is then processing it, your experience, your emotional experience, your current context, your thoughts and emotions about the future. All of these would make up your individual pain experience. There isn't one part of your brain that is in charge of your back pain, for example, or your knee pain. And this has really important implications, because if you can imagine that this is what a grandma neural map might look like, this would be similar to how we might understand how Barley at the start there would have a neural tag or signature for eating food. He would be able to see the visual part of the food, he'd be able to smell the visual part of the food, and all of this would make a output of salivation. See the food, I can smell the food, and I'm going to prime myself for being able to salivate because I'm about to eat the food. And if every time Holly clicks that clicker, that she salivates the food, the hearing part of the brain then becomes associated with the output of the food. That means that ultimately we don't need the food. The clicker becomes associated with the reward. And that's associative learning. And that's going to, again, that can be, you could do that with a clicker, you could do it with whistling, you could do it ultimately anything. And that would make up that individual pathway. And the relevance of this would be, when I introduce Bali, and this time it's not a clicker and it's not going to be reward. This time it's going to be an electric zap around the neck. So every time he does the movement, electric activity. So his signature now is going to become wired in with neurons that fire together, wire together, an output that is negative, or an output that is, I'm going to bend down. I've had an experience, maybe you've experienced back pain for a period of time, or sciatica or leg pain. And each time you bend down for 6 to 8 weeks, maybe it was reproduced leg pain, or it reproduced your back pain. So that the pain as an output for that movement, that could be shoulder, could be neck, it could be anything that is relevant to your pain experience, but pain has been wired as a protective output. Our nervous system has learned to be able to protect us. That is potentially going to go on way beyond the time that tissues take to heal, yet we experience pain in a movement or in an activity that doesn't seem to settle down. And that's really, really important, because if we appreciate and understand that neurons that fire together wire together, so we can have associative learning. If we can learn something, we can also unlearn something. And if I was to try and dissociate Bali from this paw, and being able to produce that movement, how might I do that? There's various ways that we could either try and do it through negative reinforcement. So each time I do this, it hurts. That's going to be more like giving somebody pain, and somebody's nervous system, your nervous system, becoming protective around that movement pattern. We could try and do the movement or do the activity in a different way to what your nervous system has learned. So your sensory experience, your current surroundings, so your environment, your movement, bending down as a task, for example. How is it possible that we could try and change the input to your neural tag for bending down, or to be able to give your nervous system a chance to not have a requirement, a reference point for this has hurt in the past, bending down, I need protection, and is there a way that we can do it in a different way than what our nervous system has become protective over? And that's really an important point of what this is illustrating here, which is all these parts of our brain that should be normally processing vision, movement, hearing, are doing what they're designed to do. They can become involved in a pain memory or start to become associated with a movement that has become painful. And if we do that movement more often, our nervous system gets better at it, especially if it becomes protective. And what we want to be able to illustrate and get across here is that if we can learn a pattern, we can also unlearn a pattern, to progressively move our nervous system and our brain back to processing movement, being able to process an environment in ways that don't ultimately require protection. So a phrase that we like to use is neurons that fire together, wire together, associative learning, just like we had with Bali at the start there, but also that if we don't reward at the end Bali's movement, he would eventually stop doing that movement. Or if we take the negative one, we don't have that painful negative experience, we find a different way to experience that movement, we can change our nervous system's requirement of protection. And this is ultimately what underpins what either I or your healthcare professional might be using to be able to explore novel movements. Your nervous system hasn't developed a reference point for protecting you. So we're going to see potentially if we can do some bending tasks that is simply in a different way to what you maybe have done for a long time or even ever before. Maybe your healthcare professional is going to expose you to some animal movements, walking like a frog, walking like a bear, being able to give you novel ways of experiencing bending down that your nervous system can say, okay, I haven't experienced anything negative here. I don't necessarily need protection. Maybe your healthcare professional is going to be exposing you to novel ways to get your arm overhead. It could be tasks hanging. It could be physical activity that involves some games or some problem solving. They may be working with you to be able to give you a task that you've got to solve. And they might not give you the answer. If you're really struggling, they might give you some probes, but ultimately there's going to be lots of ways to solve a task that ultimately will lead to more challenging tasks. And from a clinical reasoning perspective, and from your engagement in this perspective, we're trying to give our nervous system a different experience to what it has potentially had in the past that required protection. It's all about what we're trying to do is get a positive experience with movement that, like Bali, means that we're more likely to do it again. I'll give you an example of how and where this has impacted me. I love walking in cities, and I go on city breaks to try and check out cities, learn about culture. And when I do so, if I go to Berlin, if I go to Copenhagen, or if I go to Cardiff, I have to literally plot where coffee shops are every 10 minutes because I get back pain when I walk in a city. And some people you might hear this and say, okay, so maybe you've got, maybe you walk a little bit different when you're in a city. Or I walk hours in mountains and don't get any back pain. I train from a tissue and a loading perspective. Walking in a city is certainly not a higher intensity that is outside of my capacity to be able to manage it. And it's being able to then appreciate and look at all the different things and how I would reason this to myself is that potentially at some point I've had a negative experience with being in a city, that my nervous system produces pain as a protective mechanism that just doesn't conform to it being explained by how hard that as a task would be. You know, how would I want to violate or undo that potential learned association? Well, I would want to try and get a bit of exposure to walking in the city, but then leave so that I don't get the back pain, and do that with a graded exposure, maybe again the next week, leave the city before I get back pain, and over time try and do a little bit more so that I don't get the negative outcome, but my nervous system can experience. Logistically, that would be an absolute nightmare, and it's not that important to me. I can just deal with coffee shops. The relevance for if bending down, for example, is something that your nervous system is protecting you and it's been playing out this way for a long period of time. This clinical reasoning opens up the opportunity for us to try and find a new way of experiencing that task, bending down, and then we can grade and build towards the more tasks that are important or relevant to you. So it could be ultimately picking up your child, but it starts off with us coming up with a task that sees, can we give our nervous system a different experience? And that's what the basis of a lot of the tasks that you may be set to do. And they should hopefully also be a little bit fun, so that you're actually trying to focus on achieving the task and then mastering and moving on to more challenging levels. So this feeds into, again, what we're working through is an unfortunate saying that a lot of people will take from this from this contemporary biopsychosocial way of looking at pain, is that pain is in your head, which is a really unfortunate saying, because while these changes, and a lot of these changes, are going to be in the brain, they're going to be individual to you. They're going to be, they're going to be one place or point of mechanism of trying to adapt, working on these pain signatures, which are in the brain, but for hopefully all the reasons that we've discussed here. And we can look at animals and be able to look at hopefully taking and guiding you through a return to function, employing some novel movements, and those hopefully will be enjoyable. Okay, so your healthcare professional will be able to create and support you through these tasks, or you're maybe going to be simply saying, well, I want to try something new to give my nervous system an opportunity to change and to change the output for protection, whether that's a sport, whether that's a type of dance, whether that's a mind-body practice. That is going to be the basis of novel movement to try and change your nervous system's requirement for protection. Okay, good luck and see you in the next session.